this be one of the best moments of your life. You're listening to the Business Mirror podcast for a broader look on business with Senior Editor Dennis Estopase.
Good day. Welcome to the Business Mirror BM Broader Look podcast. Today's podcast focuses on diabetes and COVID-19. We podcast the abridged version of the story titled Viral Romance of COVID-19, Diabetes Adds Challenges to Pinoys Under Lockdown. The story was written by Business Mirror contributor Claudette Mocon Siriaco. The story was published on November 19, 2020. For the text version online, please go to www.businessmirror.com.ph and search for Broader Look. For the print edition, please read the Business Mirror newspaper. Let's get on with the story. The world is your oyster, but don't be one. For one, humans are far from being mollusks. For another, being sedentary doesn't help, especially during lockdowns. Being sedentary is doubly hard and risky for nearly 4 million Filipinos with diabetes. According to Makati Medical Center Endocrinology Section Chief and Physician Jamie Aragon, there is data that the prevalence of pediatric type 2 diabetes mellitus is higher now compared to 10 years ago, especially among children. This is largely due to more sedentary lifestyle, Aragon told the Business Mirror. Children are glued to computer screens and television sets, and with the online school happening because of the pandemic, this will potentially increase prevalence of obesity and diabetes. Aragon, the past president of the Philippine chapter of the American Association of Clinical Endocrinologists, replied to the Business Mirror's inquiry on the prevalence of diabetes among children. Children who are unable to play outside tend to just play with video games or watch online shows, Aragon said. Without exercise, sedentary lifestyle will prevail, Aragon added. Abbott Laboratories Incorporated Philippines General Manager Robert Wagner told the Business Mirror that diabetes is a matter of concern for many Filipinos. Wagner cited the recent report by the Philippine Heart Association Incorporated, which stated that over 4 million Filipinos with diabetes are at significant risk of developing cardiovascular complications. Diabetes is also a major cause of mortality in the Philippines, Wagner added. Wagner said that countries in Southeast Asia, including the Philippines, have witnessed the highest rate of diabetes globally. What's particularly worrying is the earlier onset of type 2 diabetes, which brings with it increased risk of comorbidities over the lifetime of a young individual, Wagner said. Wagner noted that Philippine data show that visceral adiposity, which is the fat enclosed by the body cavity containing the viscera, for example the thorax, abdomen, and pelvis, is an important risk factor for diabetes. Wagner also pointed to previous studies that underline low levels of high-density lipoprotein or good cholesterol among Filipinos. Wagner said that in recent months, COVID-19 has made a difficult condition complicated to manage as enhanced quarantines have limited movement, and those with diabetes are finding it difficult to remain active or visit their doctor regularly for regular consultations. Wagner added that cooped up at home, away from friends and social interactions, have been emotionally tough for people. Since the lockdown, the coronavirus disease 2019 is unforgiving to diabetics, according to Dr. Rima Tan, Vice President of the Institute for Studies on Diabetes Foundation. At this time, we already know that when COVID-19 affects a person with diabetes, the symptoms are more severe and the mortality rate is higher than in those without diabetes, Tan told the Business Mirror. Dr. Tan added that Filipinos are resilient, resourceful, and especially for those that have the means, most have actually adjusted well to life in quarantine. Dr. Tan said that the challenges at the start were availability or access to their maintenance medications and to their healthcare providers. Dr. Tan said regular follow-ups were delayed, and even for those who had symptoms or signs of other medical conditions, consultations and hence therapy were delayed because of fear of exposure to COVID-19 when going to the hospital. Aragon agrees, saying that the correlation of COVID infection and diabetes is established in medical literature. This information has spilled to the general public, Dr. Aragon said. Dr. Aragon added that most of his patients know this and they have taken measures to avoid being exposed to the virus. However, life in lockdown has its consequences. Patients feel anxious and sometimes terrified, Dr. Aragon added. According to Dr. Richard Elwin Fernando, Vice President of the Philippine Society of Diabetologists Incorporated, diabetes and COVID-19 is a viral romance. Surveys, observations, and scientific journal articles all attest that diabetes is a comorbidity that worsens COVID-19 outcomes, Fernando told the Business Mirror. Let us leave these bad outcomes to the intensivists or critical care physicians and see the viral romance outside the hospitals and intensive care units, Dr. Fernando said. Dr. Fernando explained that the general community quarantine and lockdown forced all to stay home and a significant few were stranded away from home. Dr. Fernando echoed Dr. Tan's observations that many who have diabetes had problems procuring their medical supplies, food, and other needs. Many stopped or modified their medications, Dr. Fernando said. Dr. Fernando added that dialysis patients were doubly challenged. Doctor follow-up, checkup, and laboratory exams all had to be postponed. Dr. Fernando added that those in isolation may experience anxiety and depression. Indeed, Dr. Aragon said that those who have no strong family support are at risk to be in depression. Dr. Aragon said when there are no one to do the market runs, they order from fast food restaurants and it can ruin their sugar and blood pressure control. There were changes in diet and exercise, Dr. Fernando reiterated. A lot discovered the convenience of ordering food online and having these instantly delivered to doorsteps, and they gained weight and poor control. The downward spiral into a sedentary lifestyle may be good for oysters and those selling these as a luxury dish. It is costly for those with diabetes. And the cost of treating diabetes is costlier than treating COVID-19 patients, according to Health Undersecretary Maria Rosario Vergere. Treating COVID-19 is less expensive compared to the treatment of diabetes, Vergere told the Business Mirror. According to her, diabetes requires long-term care, including daily intake of maintenance medicines and, if with complications, will result in more financial difficulties. Data from the Department of Health reveals that the highest first case rate for diabetes mellitus with coma or ketosis, which is the state when the body gets fuel from ketones or the byproduct of fat, is at 15,800 pesos with healthcare institution fee at 11,060 pesos. The lowest first case rate for the same group is at 12,600 pesos with healthcare institution fee at 8,820 pesos. The professional fee ranges from 3,780 pesos to 4,740 pesos per case, the Department of Health data revealed. According to Undersecretary Vergere, the Health Department has not costed yet the impact of diabetes with COVID-19. Undersecretary Vergere told the Business Mirror that the case rates remain up to this moment. Dr. Aragon told the Business Mirror he is unaware of local data for the cost of diabetes treatment. He noted, however, that in the United States, this can reach hundreds of billions of dollars. This is because of the complications of diabetes range from the minor wound infection to heart attacks and stroke, which can be devastating and can affect lifelong quality of life, Dr. Aragon said. So the key is prevention before the complications set in and education for patients and their families, Dr. Aragon said. According to Wagner, the biggest hurdle in managing diabetes effectively is self-awareness of one's condition. He noted that Filipinos in urban areas who responded to a survey by Abbott Laboratories claimed that they manage diabetes well. In reality, their post-meal glucose levels and HbA1c levels tell a different story, Wagner said. According to Wagner, another barrier in managing diabetes is the technology for monitoring glucose levels of people living with diabetes. The technology hardly evolved for 30-odd years, and the only feasible option for a quick result was the finger-sticking method, according to Wagner. Wagner noted that the survey by his company also highlights this, with survey doctors stating that finger sticking during blood glucose monitoring is generally rated as a hindrance for effective diabetes management. Glucose monitoring technology has been a massive enabler for people living with diabetes globally, Wagner said. Wagner added that the digital nature of this technology today enables real-world insights that make diabetes management more effective. Nonetheless, Wagner admits that awareness is still key to diabetes management. While technology has been an enabler, it is the doctors, nurses, and healthcare professionals, clinical bodies and patient associations and governments across the world that have recognized the need to drive awareness about diabetes and continue to make life better for the more than 460 million people living with this condition. A recent consumer survey commissioned by Abbott Laboratories among 200 urban area-based Filipinos with diabetes, their caregivers and doctors, shows that 8 out of 10 people with diabetes surveyed believe that they manage diabetes well. However, Wagner said that 9 out of 10 respondents have high post-meal glucose levels greater than 140 milligrams per deciliter. The survey also highlights that 62% of the survey respondents have HbA1c of 7 or more, indicating that diabetes is not being managed well over the longer term, Wagner said. Since 2011, the HbA1c has been endorsed by the World Health Organization for the screening, diagnosis, and monitoring of diabetes mellitus, which refers to a group of disease that affects how the body uses blood sugar or glucose. To track their glucose levels, most Filipinos would have to endure multiple painful finger pricks each day to ensure they are in a normal glucose range, Wagner said. The hassles involved with this traditional technology were a significant barrier to knowing one's glucose levels and consequently being able to manage it effectively, Wagner explained. Thankfully, technology has evolved. Technology is also in the mind of Dr. Tan. Dr. Tan told the Business Mirror that one best practice that has been identified or pushed forward is the use of telemedicine. Dr. Tan said people now know that for some medical conditions like diabetes, virtual consultations will work and people were forced to adapt quickly. According to the physician, virtual consultations answered a need that was seen in the early days of the quarantine. And moving forward, this practice of telemedicine is here to stay, Dr. Tan said. Dr. Tan added that coupled with remote monitoring technologies, telemedicine is now a powerful tool to overcome distances imposed by the lockdowns. Dr. Tan personally thinks that the government is not doing much in the battle against diabetes, especially with the current COVID-19 pandemic. Today, the prevention of diabetes is more important than therapy, Dr. Tan told the Business Mirror. Although some medications for diabetes have been made available for free by the Department of Health, the promotion of healthy lifestyle and prevention of chronic non-communicable diseases like diabetes should be a priority, Dr. Tan said. Setting the right priorities will be very helpful, she added. According to Yusek Vergere, provision of free maintenance medicines and insulin vials through city health offices and or rural health units nationwide is also in place. Undersecretary Vergere said that currently, diabetes services are continuously being given, especially in primary care facilities, since it is considered as an essential health service. Still, Undersecretary Vergere admits government support can still be markedly improved. At the moment, government needs to strengthen the centralized registry of diabetes and its complications, Undersecretary Vergere said. More importantly, government needs a nationwide campaign for diabetes prevention through healthy lifestyle, she added. According to Dr. Tan, inequity differentiates the public and private responses to diabetes as a major health concern. The main issues are access to all kinds of resources, Dr. Tan said. Dr. Tan added that to have an integrated approach, the government should lead and all private diabetes-concerned organizations in the Philippines should come together and work hand-in-hand in this fight against diabetes. Dr. Fernando also noted the opportunity for a unified approach. Dr. Fernando said that both the public and the private sectors want the best for patients with diabetes. Both work together for patient education and screening. Dr. Fernando said that the differences may be obvious in choices for intervention. Dr. Fernando explained that government physicians treat the poorest and the most financially challenged portion of the population. To be able to treat more, they have generic diabetes tablets and human insulin vials that are cheaper but also efficacious and safe, Dr. Fernando said. Dr. Fernando pointed out that almost all of the newer agents, tablets, and injections are available but at a cost. Fortunately, guidelines in the management of diabetes from reputable international diabetes organizations, which physicians generally follow, also consider this real issue, Dr. Fernando said. Diabetes organizations may have different programs and activities, but all are focused on the patients and how their lives can be improved, Dr. Fernando added. According to Dr. Fernando, urban institutions that treat patients with diabetes mostly have access to specialized referrals. As this remains to be a challenge in rural areas, it is an opportunity to bring technology accessible to patients in these far-flung areas, Dr. Fernando said. He noted, however, that there is a government-integrated plan or approach for the prevention and control of non-communicable diseases and involves many medical specialties and subspecialties. The bigger challenge is still in the basic practice of people with or without diabetes, Dr. Fernando said. And according to Dr. Aragon, to meet these challenges, the best practices, though hackneyed, are still social distancing and wearing masks. Dr. Fernando agrees the proper wearing of face masks cannot be overemphasized. Dr. Fernando added that sanitizing hands before touching the face must be a habit and physical distancing needs to be realized and practiced at all times. But people with diabetes seems to be more careful and adherent, Dr. Fernando said. The physician emphasized that every Filipino should adhere to these measures, as nobody can be definite if the country has reached the height of the pandemic or how much longer it will last. Nonetheless, Dr. Fernando said physicians and health workers in the private and public sectors will continue to respond to this challenge with determination.
Thank you for listening to the Business Mirror podcast. For a broader look on business, follow us on Facebook and Twitter at Business Mirror. Until next time.